All right. Well, thank you everyone for being here. Thank you to Elizabeth and Anna for just being willing to share their knowledge and share this topic with all of us today. They will both be presenting on the Massachusetts Behavioral Health Helpline. So they have PowerPoint slides they're going to go through. Elizabeth is going to be monitoring the chat. I think, correct me if I'm wrong, you would like to address questions at the end of the presentation, correct?
Yes, definitely.
That's correct.
Yeah, but if anybody has in between the slides, feel free or enter it in the chat. Like you said, Elizabeth will be monitoring the chat and will respond.
All right, perfect. Thank you. Well, I am going to hand it over to you two. If you just want to briefly explain who you guys are, what your organization does, and what your roles are, and then you can get into your presentation.
Sounds good. Should I go first?
Yes, Elizabeth, please.
My name is Elizabeth Frontang. I'm a community relationship specialist, representative for the Massachusetts Behavior Helpline. Anna and myself cover the central Massachusetts region. And basically our role is to go out and spread information about the behavior helpline. So those who are vulnerable population or who that need to learn about the helpline to get resources, know about it. And just look for people who want to collaborate with us to share the resources for our helpline. So when people do call that have a special needs that one of those agencies or partners can help with, then they know about that organization as well. And now I'll let Anna introduce herself.
Oh, thank you, Elizabeth. And thank you, Jordan. Jordan, did I pronounce it right? I'm sorry. Thank you for giving us this platform to present this helpline. But my name is Ana Artavia Spain with a hyphen. I am also a Massachusetts Behavioral Health Helpline representative, community representative, and we go throughout all Massachusetts just trying to provide this important information, the resources and the services that the helpline does have for all Massachusetts residents. And we're very happy to be here to present to all of you. We want you to be our ears and eyes, and we want you to pass along this important information to everybody as much as possible, as you are aware that it is a crisis right now. Mental health is a crisis, and it is the second leading cause for death in the Massachusetts area, all across the United States, for mental health and addiction. And so we want to be able to provide this information to everybody because we are here to help. And with further ado, can I share the slides? Okay, let's see. Okay. I just closed it. I am so sorry. It'd be just a minute.
That's okay. Take your time. It does say on here, just so you know, you do still have the co-host permission, so you should be able to share it right through here.
Earlier, I closed it when I went in. Okay, can you see it?
There we go. We're all good.
Excellent, excellent. So again, thank you for allowing us to present. We are community relations reps for the Central Massachusetts, and that covers a big chunk of Central. We go from now north to south all over the Central Massachusetts, and you are aware that the region is so big. So I am glad to have Elizabeth as a partner that covers most of the majority of the regions. We are the Massachusetts Behavioral Helpline. You could contact it, or you could get further information just by going to masshealthhelpline.com or calling us. If you're after this presentation, you have more questions, you could connect with us, of course. But if you're trying to provide that number to somebody that really needs it, you could go to, you could give them 833-773-2445, We are, the Massachusetts Behavioral Helpline is under the umbrella of the Department of the Mental Health. So as we are proceeding, we're trying to provide this information as much as possible for the Massachusetts residents, and provide them what kind of service we have and what kind of resources we have. It is part of the roadmap for behavioral health reform and is available in the Commonwealth of Massachusetts. And of course, we are aware that most, if none, will be calling from out of state. And we still could help them by providing them that warm handoff to that their state agencies, their emergency assistance. So we will do that warm handoff. But this is a Massachusetts helpline. We just launched on January 3rd. So we are brand new to the Massachusetts. There is 3 ways you could connect with us. You could call, text, chat, or 24 hours a day, 7 days a week, all year round. We also use the Rally, the 711 for hearing impaired. We provide individuals with a warm handoff to community behavioral health centers in the Massachusetts. There is 25 in Massachusetts altogether, or any other providers in the community. We also include 911 in case there is an emergency, like a death, life and death situation. We also make it not only available, but accessible by providing translation in 200 plus languages. So if English is not your first language, there is no problem. We could still help. And that is an extra layer of that. We know most individuals, they tend not to call because they don't speak the English language. They don't know if they could get the help they need, but they don't have to worry. We do come in 200 plus languages translation. So you're asking, how do we connect? We connect individuals or families with a full range of services and treatments, such as outpatient, urgent care, immediate crisis intervention. We provide real-time live triage assessment. And this is an extra layer that this helpline has, that assessment. You only find this assessment triage in emergency rooms. They do an assessment, they do a triage, but the helpline does provide this in real time. So every call do get that in multiple languages 24/7. We also collaborate with existing statewide services such as 211-988, just to provide them the information that we do have. And also we collaborate because we do have, we get calls that probably they're trying to call 988, that went through our line. So if they want to continue speaking with them, we could do that warm handoff to those agencies. Of course, we will provide them with our information, what we could do, what kind of services, what kind of resources we do have. We also connect with or deployed the adult or the youth service crisis intervention in case of emergency. When that does happen, the helpline dispatch, the adult or the youth mobile crisis center, they stay on the line until they get to their home. Once the helpline does hear that they are there, then they will back off the call because they know they're going to get the care that they need. We do warm handoff to community providers to all callers, and that's again another extra layer that we are going to be talking in the coming slides. We do that by connecting them with a community behavioral health centers or any other provider in their community. And what is so special about the helpline is that we follow up after they get connected. And that is the most important thing, because we want to make sure that they got connected, they got that first appointment. What other resources do they need? Because remember, this helpline is also have other resources that we could provide. We have peer support specialists that not only support every call or every, urgent or crisis intervention, but also support our helpline callers. We have resources to ensure the callers to get support they need, like transportation, childcare, food. We have many resources. And the last one, I'm going to be talking about all of them, but the last one is crucial because as you all know, that these individuals or these families are calling into the helpline and they are going through a crisis. So we do not want them to continue saying the same thing over and over. They're going through a crisis themselves. So we tried as much as possible to send that assessment, that triage that we took at the beginning of the call to the provider that we do a warm handoff so they could get the care that they need. And I'm going to be talking a little bit about that in the next, in the coming slides. So this is how it flows. The helpline, the one that is answering the calls, they are bachelor's, master's degree clinicians. They are experienced on handling these calls. We also have peer specialists. Again, we're open 24 hours a day, 7 days a week. The caller calls in, the helpline clinician answers the phone, introduce herself. They will have a conversation about why, they call, what kind of crisis they're in. They will start the assessment process, the triage, right away once the conversation starts. Once they are connected, the clinician will determine what kind of services they need. Because remember, these individuals and families, they know that they're going through a crisis, but they don't know exactly what kind of services they need. So the triage and assessment will provide the clinician what kind of services they're going to need. What is the next step? With the permission of the caller, because everything is provided with the permission of the caller. If they do want to be transferred to the community behavioral health centers or any providers in the community, they will do that warm handoff by the helpline calling either the community behavioral health centers or any other providers, doing that warm call with the caller on the phone. Once they're connected, the helpline will introduce themselves as the helpline and will also introduce the caller and will provide the provider that crucial information about the caller with the caller's permission. Once that connection is connected, the helpline will back away from the call. And the next step, and this is how it flows. There is no hold. The caller from the behavioral health with the individual seeking assistance, they will briefly introduce themselves, the helpline, and it will continue until they get connected to the provider. And this is the most important thing. This is the last thing that the helpline does once they disconnect from having them connect together, is providing them this clinical, the assessment, the triage to the provider. This is sent via email, secure email to the provider that is going to help this individual, this family. And this is all the information, the triage, the helpline took at the beginning of the conversation. And this is the most important thing, because we don't want this individual to continue talking about why they call over and over again. They're going through a difficult situation at this moment, so we want to provide them as much as information as possible so they could get the help they need as soon as possible. And the key takeaway from this is this helpline is open 24 hours a day, 7 days a week. We could help. It comes in 200 plus languages. If English is not your first language, you don't have to worry. We do have clinicians, and even if you do not want to be connected to a provider and you just want to talk, you want to be able to, you're going through a difficult time, but you don't want to be connected. You just want to talk to somebody. We're there also. We provide that service. Our peer specialists are available. Also, this helpline is for youth and adults. So let's say if a person calls in after hours, and they cannot get connected if it is not urgent, and they cannot get connected because all providers are not open 24 hours a day like the helpline. Unfortunately, we would love to have that, but unfortunately it does not happen. If it is not urgent, the helpline will ask the caller what time they could call them the next day, so they could do that warm connection right away. So the helpline will call them the next day at the time that they want. And so the connection could be made to the community behavioral health centers or any other providers. So that is one of the key issues. Now, if it is urgent, even if it is after hours, the community behavioral urgent care, they have on-calls, so they could get connected right away. We do also have brochures in 13 languages that are free. We will be more than happy to provide them to you. All that information, Elizabeth will send you along with this slide so you could share with everybody. Also, we would like partners. So we would love to have you as a partner. The helpline is asking for the community as a whole to provide us information. So in case somebody calls in and they feel for resources and they feel that your agency, it will benefit them, they will do that warm connection to you. So we would love to have you as a partner. The next slide is all the community relationships reps all around Massachusetts. There is 2 in every region. Elizabeth and myself is in the central region. We have 2 in the Boston, 2 in Northeast, 2 in Southeast, and 2 in West. So if you should need any of us, feel free to send an email, or, if they do not respond, Becky, she is our supervisor. She will send along an email to us to respond right away. So thank you again for having us present this presentations. And again, like I said at the beginning, we want you to be our eyes and our ears in the community and to pass along this important information. And why I said I want you to be our eyes and our ears is that we want to hear back, a feedback, either good or bad. If it is bad, we want to nip it in the little bud right away so it does not happen to anybody else. But if it is good, we want to hear those good stories, and share it with our colleagues, in our organization, what is working and what is not working also. And so thank you so much, everyone. And the last one is the information, the Massachusetts Behavioral Helpline, the email and the phone number that you could pass along. But we will be more than happy to provide the brochures and the slides and everything that you need. Thank you. And for now, I'm going to stop sharing.
All right. Thank you so much. That's wonderful. Does anyone have any questions for Anna or Elizabeth?
This is Rebecca. I don't have a question at this point. I would just like to acknowledge how wonderful this sounds. And it was interesting. I like the warm handoff because I think so often the connections break down. And I think that's critical. So I'm excited. What kind of response have you been getting in terms of utilization?
Very good. We've been connecting a lot to all organizations, and I've been hearing good feedbacks so
Great.
far. You know, there is glitch here and there. Of course, this is a new helpline, and that's what we're asking everybody to be our ears and eyes open and give us feedback, because of course it's a brand new helpline and there will be glitches at the beginning, but we want to fix them so it will not happen to anybody else. But so far we've been having positive, and we've been getting a lot of calls in.
Wow.
And we've been helping a lot of people.
Good.
Thank
Excellent.
you.
Thanks.
This is
Yeah.
Carrie Ann.
Yes.
I just want to say the redundancy is huge, especially for people in a crisis. The amount it will take that person even to make that initial phone call is huge. So just saving them from having to repeat themselves over and over again. Like, it took so much for them to call somebody and say this to begin with. So I'm excited about this. I think this is going to be great for our community. So thank you.
No, thank you. And it is so true. We don't want them to repeat themselves over and over. I don't know if you have called a doctor and you try to call the doctor, okay? The first answer is the receptionist. Of course, you give them all the information and you would think that they will pass along why you call. Then they say, oh no, you need a nurse. Then they connect you to a nurse. While they don't even have all your information, they don't have nothing. So you're repeating all over again. We don't want this for these individuals of these families. Is crucial. They made the first step. They're going through a crisis. We don't want them to continue repeating themselves. And that's why the connection, and also afterwards sending the triage, the assessment, the information, the most crucial information to the provider, so they wouldn't have to be asked over and over again, so they could get the services they need right away.
The part that I keep going back to that I love so much about this is the fact that this helpline kind of sets itself apart from other helplines because so much more is offered. The transportation, food. I mean, that's huge when we think about CASA and the neglect cases that are coming in. A lot of times it's because of limited resources. So this kind of, help intervening at the right time is it's crucial. So I love everything about it. I think it's awesome.
And it is so true. I always say that this Massachusetts Help, and not because I work for them, and not because of that. I love every part of it because it's working, it's helping. But I always say, because what I hear the most is every time is there is so many helplines. No, there is a lot of helplines, but we have an extra layer, which is the warm handoff, the triage assessment, all these things, especially the triage assessment, you can only find that in emergency rooms and in your doctors when they do an assessment or triage. You do not find this in another helpline. The warm handoff, that is a crucial. Providing that initial assessment to the providers, that is very crucial, so they don't have to repeat themselves. So that's why I said this is an extra layer. There is an extra layer to this helpline. And
even the callback, Anna, like you mentioned, is very essential, because sometimes people in crisis, I have myself throughout my life access helplines, and I was like, wow, they spoke to me for like 20 minutes, but they don't care what happened to you afterwards. So we just really want to change that too. So we keep calling as necessary. And again, you don't have to be in a crisis. You just have to know that something is wrong and that you need help and support to access the helpline, whether you're a parent or whether you're a young person looking for resources. And I think that's the most important thing to take away from this.
Yeah.
I just want to say too, I think I've met a couple of your representatives. I've been out in the community with our tables, and I was like, oh my goodness, they need to do an Ask Us, and here you are. So I was
Yes,
in North
we
Brookfield.
met.
So it was so wonderful. And then at in Auburn not too long ago, about a week ago, my colleague Chrissy and I were there, and it just having that kind of investment in the folks that are spreading the word, it makes it more comfortable to talk about. It makes it, you feel confident about what you're talking, that you're, you know, promoting something that's really solid, and that you say, listen, just, you know, try it if you need it, and that's it, and they're there. So I just wanted to thank you for being here so quickly.
Thank
No,
you.
thank you, Gloria. And we met at Auburn at the event. And I just have a little story about that event. I was tabling the event, and I saw so many. It was such a wonderful event for foster children. And it was a back to school, and I was there. And of course, I was providing information, brochures, talking about the helpline. And one lady in particular she made me cry. She just came, she had her family alone, but she came to my table and said, can I hug you? And I'm like, just thinking about it, it gives me tears. And I said, yes, of course you could hug me. And then I say, okay, I know everybody loves hugs, but why this one in particular? And she was telling me her story. And I thank her for sharing her story, because her story is her own, and she shared it with me. And the fact that she says, I have called so many times to the helpline, and it's just to talk, because I was going through a terrible, a difficult time. But what is so wonderful about your clinicians is they stay on the line. And she says, I talked for hours. I talked like for 2 hours, but they stayed on the line. They were in no rush. And it made me feel good. It made me feel good that somebody was helping, and she reached out and somebody was there.
Great.
That's
This
hope.
sounds
Story.
Sharon, hope.
But I have a question about the capacity.
Yes.
So I have a question about the capacity. Like if I tell somebody to call, but other people are calling at the same time. I mean, how do you handle the fact that, on 10 o'clock on a Thursday night, there might be 4 or 5 people in crisis? How does that work?
Right now we are handling, so far so good, but we are hiring more clinicians. So if know if anybody is looking for a job, they have to be in Massachusetts residents. But we are hiring, but so far so good. No call has been put on hold. No texts have been put on hold. So far, everybody have been answered. We have been so far, and let me cross my fingers that it continues. I'm sure it will continue, because they're hiring more clinicians. So that would not happen. I hope I answered your question, friend.
Yes, thank you.
Thank you. And that is a really good question.
I have a question. What's your connection been with DCF?
We have provided presentations regarding the helpline to all DCF. So far has gone really good. They're welcoming this helpline, which is excellent, because we're working with vulnerable people, with the families that really needs it, and the children. So far it has been excellent. It's been a warm connection, the DCF's agencies. Yes.
Great to hear. Thank you.
And great question.
Any other additional comments or questions? No?
I think,
Yeah.
Jordan, maybe we should somehow incorporate this into people who have newly reunified families.
Yes.
I think that's a time of struggle as well, and adjustment. So I think that might be helpful for them, for the
I think the more
childcare,
we can push it,
transportation.
Yeah.
push it hard.
And I may say, we also do presentations for, I don't know if you have a support group, parent support groups. We also do presentations for them. I'm bilingual, I speak Spanish, and so is Elizabeth. So we do both in English and Spanish.
That's awesome.
And even it would seem like getting some information to the court system,
Mhm.
because when the either an adoption takes place or the
Yeah.
reunification takes place, it always goes through the court system, but then a lot of the supports, for instance, of CASA might disappear. So to get this as part of that reunification piece seems like it's really important.
That's
there's-
really good.
There's so many waiting lists for everything. So just knowing that there is a line that anyone can call and get immediate help is just, it just changes everything. It's great.
So maybe a connection with the court clinic too.
Mhm.
If you're able to connect with the Worcester County court
Mhm.
system, somehow they have a court clinic, maybe that, or probation, that would be a good connection because they connect with those families for maybe CRAWS as well.
Yeah.
Or, you know, cases where we're no longer involved after reunification, so.
Yeah, we have, and that is a really good suggestion. Elizabeth just put it, but we have contacted most of the courts. We have contacted the police department, the emergency rooms, the hospitals. So it's up to them. I can't push it. I mean, we provide the information, we give them all the tools. It's up to them to continue the work, you know? So, yes, of course, we go everywhere. We provide the tools, we provide the information, but it's up to you to move it forward, to continue that work that we gave you, you know, to provide that information to families and people that most needed, you know?
Yeah, like Anna said, sometimes we do reach out to them. We went to like a chief conference for police officers, and you know, they seem excited in the moment and they take the
Yeah.
information and we follow up with them, but then we never hear back. So unfortunately, still a lot more work that needs to be done with kind of those relationships with sharing that information. And you know, their work is very stressful and there's a lot going on. So unless they have like an appointed person that handles like case management or community outreach or community relationships, they tend to be like, oh, this is great, go connect with this person, and then we try to connect with that person. So there's still a lot of work to be done in terms of connecting with police officers, with school, with primary cares, and just those kind of things. But this sounds like really good suggestions. And like I said, email us if you have like a specific contact or specific name of an organization. Sometimes it could be a little complex because we don't want to like just bombard people by walking in. So we try to do the emails first and be like, hey, how's it going? But sometimes those might go unanswered or go into the spam email or just take a while. So, but I'm just really, you know, happy by the work that we're doing because I don't know too many helplines that actually do all this kind of like work in terms of doing the community outreach, at the same time collecting resources to add to the helpline, and at the same time building partnerships between organizations to help, you know, people in their community. So I think that's amazing.
Elizabeth,
I would just add, as school opens up, that reaching out to the schools, the public schools, the private schools too, but particularly the public schools, either through their guidance or through, in Worcester, we have a new superintendent. I'm sure there's somebody who does the community liaison stuff, although I'm not sure who it is, because it seems like giving your brochure or your number to students, particularly in the middle school and high school age, might be really important.
And I agree with you, Frank. I really do agree with you. And that it was one of our major targets is the schools. However, probably because it is they were on vacation, nobody was there, nobody.
Yeah.
So right now there is I've been hearing a little bit back from the schools, trying to connect, trying to get a presentation, but it's really hard to get into the schools, even through a guy, you know, the
Guidance counselor.
principal, the guidance counselor. It's really hard. to
And
get
there's
in-
many logistics that go into it, like you said, without, there's not much you can do without the parents' permission, even if it's just to share resources. And we have heard a lot that they're trying to appoint a specific points of contacts for schools because they're realizing there's a lot of kids who are in school who are homeless, who are experiencing difficulties. So from what I heard, there's something in the works of that, but we don't know who that contact person might be just yet. So that's something we want to do down the line because that might be more efficient than doing that. Because even if we, let's say, contact to a school or a principal, the way that they're going to do it, it's probably going to be like an assembly or some kind of way, or just putting it in areas where students can see it. But anything like that, like I'm a parent with a kid in Worcester Public Schools, and let me tell you, it's a maze. Like you have to like get permission for everything, and it's just very particular. So we're still trying to figure that out. But if they have like a health fair or a situation where we can come in and share information, we try to do that because we have found that to be more successful.
And one thing that I wanted to say, and I totally forgot while I was presenting, is if a child calls in and let's say is 13, 14 years old, and they would like to talk, we do not need permission from their parents or the guardians. However, if that particular child through a triage and assessment, the helpline, finds that it needs further or urgent care, then we do need a permission from the parent or the guardian to refer them or to do that warm connection to the community behavioral health centers or any other providers. I just wanted to put that out there. But just to talk to a clinician or a peer specialist, they do not need permission from the parents.
But many times than not, the parents has been open to having a conversation with the clinician after the child expressed that they were the ones to reach out and that they're looking for support and that they're going through a difficult time. More than not, the parent has being able to, come around and understand the needs of that child and want to work with us in the helpline so that that young person can get access to resources as well. And we also have support groups. So some parents might not be open to, like, say, a food therapist, or, they're still kind of a little bit on denial of that child going through a difficult time. They might want to start with a support group. They might start connecting with the school counselor. So we're just happy that we have parents that are, open-minded to taking some steps toward getting their child the kind of help that they need for substance abuse, for mental health, and just getting more resources so that they can feel better.
The other place I was thinking of, I don't know if you've already been in conversation with the sheriff's department. I know that there's a lot of, emotional things surrounded by that when one of the parents is incarcerated. And I know he would love to promote this for his folks there. So I don't know if you need a connection there. I can send you his contact information, but
Yes, please.
they do a lot of
Yes.
he supports a lot of workshops and things like that.
We have heard a lot about that vulnerable population, but we haven't had a direct contact, so that'll be great. We can start there.
Yeah, and he, he'll want you to just come and do it, you know what I mean, and talk, and I don't know how they would what folks they would have, but he'll get, whoever he thinks would benefit together, and staff and, their the folks there. So I'll send you that to your emails.
Thank
That'd
you.
be great.
Thank you.
So yeah, we wanted to collaborate with you guys. I guess we're also looking for more clarity in ways in which way does your services work. I know you guys say you served special needs children in the foster care system. Like, what is the age group? Like, what does your services look like? Because we would like to add it to the helpline. We want to send a referral form for you guys. So in case anyone is calling who might be in foster care, who might be in a difficult situation that aligns with the kind of services you guys provide, we can do that as well. As well as sending you guys some materials that you guys can share in place. So we just want to learn more about your organization as well too.
Absolutely, thank you. So it's a little tricky as to how we get on a case, because you can't really place a referral for us, unfortunately. We are only appointed onto cases through the juvenile court. So, I mean, so often we're getting emails, phone calls saying, hey, we could really use your services on a case of ours. And what we do is always say, well, then you need to speak to an attorney on the case to get us appointed onto the case. So I don't think there would be much movement there with, you know, placing referral to get our services provided for a family. We are foster care based and it is all through the court. And the only way that we can get onto a case is if it is faxed directly from the courthouses. But we will absolutely push your information out and make sure our biological parents on our cases, caregivers, the children on our cases, we will make sure they have your guys' number to utilize that resource for whatever they need. I'm thinking, Glorianne, too, we could stick it onto the resource library document that we have, just so it's easily accessible. That's
It
something
might
that-
already be there, but I could add to
Okay.
it. Yeah.
Yeah, we have people can access it with a QR code. It's on our website. It's a spreadsheet of resources for people in the community or any of the cases that we have that people can utilize if, you know, if they need anything. So we will throw that on there as well. Oh yeah, look, Lorian's holding it up.
Look
Oh,
at that. That's
great.
great. Yeah, so
Love
let us know if you need more materials and what languages.
Yes.
And do you guys have any events or conferences or anything else coming up where we can mingle and share more information or anything like that?
Networking, yes.
Champions, Carlene.
Yeah, we do have our signature fundraiser coming up in a few weeks. So, I mean, tickets are on sale for that. That's a great networking opportunity. We also do we have a couple more things.
Or
this
if an auction
fall.
item that they could sponsor or something like
Yeah.
that would be awesome. To have their information.
We can, I know our executive director is on a committee for a National Adoption Day event, so that's something we could bring up to her as well to see if we could get you into the courthouse. It's sometime in November. I forget
I think
exactly which
November
Friday.
17th.
17th,
Yeah.
17th.
So that could be a potential option. And then the last one that actually there are two that just jumped into my head. One, the Railers opening weekend. It's the local hockey team. We're gonna somehow be involved with that. Details are pending. So that's not until the end of October. But our holiday drive,
Mhm.
having at least resources, if not maybe someone that advocates could talk to, a coffee with CASA,
Mhm.
where it's more of like a mingling scene. Champions for Children is a great option, but it's less informative and more network. So like building your network and chatting with people about what you do, not so much a resource dissemination location. But I mean, hey, you got to talk to people to be able to give the information out.
Yeah, we could have a
Anything is
conversation.
welcome. Yeah. Anything is welcome, especially like you said, around those holidays where it could be really hard on people who might be in foster care or
Mhm.
incarcerated or just in a difficult situation. So our funding is a little tight, but like whatever information you guys have or resources that we can work around, please do send us that information. And we're more than happy to work with that.
Yeah,
Yeah,
I'll make sure that I send you guys a follow-up email with context that we have or even things coming up that you guys could.
I
be
mean, we
involved.
work a lot with the United Way too,
Mhm.
so
Mhm.
if you have a connection there, they have a lot of events where they host
Mhm.
other organizations and welcome that sharing of information. United Way is huge that way.
You know, one
And-
other one, whoops.
No, go ahead, Rebecca.
Well, one other one might be the YWCA because that's where the domestic violence
Mhm.
support system resides.
We both, Elizabeth and I were both advocates for the domestic violence. We were
Excellent.
both, yeah,
Awesome.
and our prior life, I know. We were both domestic violence advocates for the YWCA, yeah.
Well, I'll definitely send a follow-up email to you guys, and then as the months go on, if connections pop up, if anything pops up, I'll make sure I connect with you guys and just keep you guys in the forefront of my mind for things like that. And of course, you can feel free to reach out to us at any time as well if you have any questions or are looking for opportunity. So, any other comments, questions for Elizabeth and Anna?
I'm just really grateful that we were able to hear about it. It's very exciting.
Me too. Me
Thank
too.
you so much for sharing the space with us. And again, we can send our information if you know anyone who wants a presentation, who wants to learn about these resources. It doesn't even have to be like a huge organization. It could be a small nonprofit or anyone, that's going through a hard time and that you need that contact information. Please let us know. And thank you so much for your time. Don't mind my son screaming in the back. I'm multitasking into school stars.
We love it. We love the
We love
children.
seeing that cutie pie.
We do.
Yeah, you should bring him in so everybody could see him. He's so sweet.
Wait, hold on. He's like, I think he's on top of something and he's falling. So he's dying. So I'm gonna go rescue him one more time. I'll be oh my God, I'll be back.
Well, thank you guys so very much. I really appreciate it. Like I said, this is recorded, so we will put it on our YouTube channel for people to watch it back. And I will send you that follow-up email and we'll go from there. But thank you guys so much. This was amazing. And we're going to do everything we can to make sure as many people as possible get this number and can be utilizing this resource. So thank you again.
No, thank you for giving us.
Thank you
this
so much.
opportunity. Thank you. Thank you.
Absolutely. Have a
Thank
good day,
you.
everyone.
Thank you.
Bye.